Eczema versus psoriasis. 10 key differences you need to know. Dealing with itchy, red, or flaky skin can be frustrating. Are you unsure if it's eczema or psoriasis? Knowing the difference between eczema and psoriasis is the first step towards finding natural relief. While both are common skin conditions, they have distinct characteristics that can help differentiate them. Understanding these nuances is crucial because the natural approaches that may soothe eczema might not be as effective for psoriasis, and vice versa. Before we explore 10 key differences between eczema versus psoriasis, please remember this video offers general information and isn't medical advice. If your skin symptoms persist, please consult a healthcare professional for a proper diagnosis. The science-backed resources supporting the information presented in this video can be found in the description below. Welcome to our daily health. Many people confuse eczema and psoriasis because they can look similar, both causing redness and irritation. However, understanding the subtle yet significant differences in their appearance, the common areas they affect on the body, the typical triggers that cause flare-ups, and even the sensations they produce can help you identify which skin condition you might be dealing with. This video will break down 10 crucial distinctions between eczema versus psoriasis, focusing on natural indicators and common experiences reported by individuals managing these conditions. Recognizing these differences empowers you to seek more targeted information and potentially adjust your natural care strategies. Here are 10 key differences between eczema and psoriasis. Number 1. Age of onset. Eczema, also known as atopic dermatitis, often makes its first appearance in infancy or early childhood. Many children experience eczema and may even outgrow it as their skin matures and their immune system develops. However, for some individuals, eczema can persist into adolescence and adulthood, becoming a long-term skin condition. Psoriasis, on the other hand, commonly appears in adulthood, with the typical onset being between the ages of 15 and 35. While this is the most frequent age range, psoriasis can indeed develop at any point in a person's life from childhood through older adulthood. Considering when your skin issues first started can provide an initial clue, with an early childhood onset being more suggestive of eczema rather than psoriasis. Number 2. Appearance of the rash. Eczema typically presents as patches of skin that are red and intensely itchy. These patches can be weepy, meaning they might have some fluid leakage, or they can be oozing. Over time, the affected skin often becomes scaly, dry, and thickened, a process known as lichenification, which is a result of chronic scratching and inflammation. The skin may also appear cracked or leathery in areas that are frequently irritated. In contrast, psoriasis usually manifests as raised red patches on the skin, which are covered with thick silvery scales. These scaly patches, called plaques, tend to be well defined, meaning they have a clear and distinct border separating them from the surrounding healthy skin. The thickness and silvery appearance of these scales are key visual characteristics of psoriasis. Number 3. Location on the body. Eczema has a predilection for certain areas of the body. It commonly affects the flexural surfaces, which are the folds of the elbows and knees, as well as the wrists, the neck, and the ankles. In infants and very young children, eczema often appears on the face, particularly the cheeks and chin, and on the scalp, sometimes referred to as cradle cap. Psoriasis, while it can appear in various locations, has a greater tendency to occur on the extensor surfaces, which are the outside of the elbows and knees. It's also frequently found on the scalp, lower back, and the nails. While both skin conditions can appear on multiple body parts, the primary areas of involvement can sometimes offer a clue. For instance, prominent involvement in the creases of joints is more typical for eczema than for psoriasis. Found this video valuable? Like and subscribe for more health tips. Drop your comments or questions below. We're eager to hear from you. Please share this video to help others. Number 4. Itch versus pain. While both eczema and psoriasis can cause significant itching, the intensity and accompanying sensations often differ. Eczema is notoriously associated with intense itching, often described as a relentless and almost unbearable urge to scratch the affected skin. This intense pruritus is a hallmark of eczema and can significantly impact the quality of life. Psoriasis can also be itchy, and for some individuals, the itch can be quite severe. However, psoriasis may also be accompanied by other sensations, such as soreness, a burning feeling, or a stinging sensation, particularly in more severe cases where the skin is inflamed, cracked, or fissured. The presence of significant pain or burning alongside the itch might lean more towards psoriasis than the typically itch-dominated experience of eczema. Number 5. Triggers. Eczema is often linked to a variety of environmental factors and internal conditions that can trigger flare-ups. Common irritants such as harsh soaps, detergents, fragrances, and certain fabrics can exacerbate eczema. Allergens like pollen, pet dander, dust mites, and mold are also frequent culprits. Temperature changes, particularly dry winter air, and emotional stress can also trigger or worsen eczema. In some individuals, certain foods may also play a role in eczema flares. Psoriasis triggers can be different and may include physical trauma or injury to the skin, the Koebner phenomenon, infections such as strep throat, certain medications like lithium and beta blockers, and psychological stress. Hormonal changes and even changes in weather, such as cold and dry conditions, can also trigger psoriasis flares in some individuals. Thinking about what seems to consistently make your skin condition worse can sometimes provide clues about whether eczema or psoriasis is more likely. For example, a strong correlation with seasonal allergies might point towards eczema, while a flare-up following a skin injury could suggest psoriasis. Number 6. Nail involvement. Changes in the nails are a common feature of psoriasis, affecting a significant proportion of individuals with the condition, estimated to be up to 50%. These nail changes can be quite distinctive and include pitting, which appears as small, pin-like dents on the surface of the nails. Other changes include thickening of the nails, discoloration, often a yellowish or brownish hue, and onycholysis, which is the separation of the nail plate from the nail bed. While eczema can sometimes affect the nails, leading to changes such as ridging, horizontal or vertical lines, or mild thickening, these occurrences are less frequent and generally less severe compared to the often dramatic nail involvement seen in psoriasis. Therefore, examining your fingernails and toenails for specific changes like pitting can be a strong indicator of psoriasis rather than eczema. Number 7. Scalp involvement. Both eczema and psoriasis can commonly affect the scalp, leading to flaking, itching, and redness in this area. However, the way these skin conditions manifest on the scalp often differs. Eczema on the scalp typically presents as patches that are flaky and intensely itchy. These patches can sometimes appear greasy or even weepy, with associated redness and scaling. Scalp psoriasis, in contrast, often appears as thick, silvery scales that are tightly adherent to the scalp. These psoriatic plaques can be quite prominent, and may even extend beyond the hairline onto the forehead, ears, and neck. While itching can be present in scalp psoriasis, it may be less intense compared to the often severe itching associated with scalp eczema. Observing the appearance of any scalp issues, particularly the presence of thick, silvery scales, is more suggestive of psoriasis. Number 8. Family history. There are distinct patterns in the family history associated with both eczema and psoriasis. Eczema has a strong association with what is known as the atopic triad, which is a combination of 3 allergic conditions: asthma, allergic rhinitis, hay fever, and eczema itself. Individuals with eczema often have a family history of one or more of these atopic conditions, suggesting a shared underlying allergic predisposition. Psoriasis also has a significant genetic component, meaning that having a family member, especially a first-degree relative, parent, sibling, or child, with psoriasis increases your risk of developing the condition. While both have a genetic link, a family history heavily weighted towards allergies like asthma and hay fever might slightly favor a diagnosis of eczema. Number 9. Seasonal changes. The way eczema and psoriasis are affected by seasonal changes can sometimes provide differentiating clues. Eczema often tends to worsen during the winter months, likely due to the dry air and reduced humidity, which can further irritate sensitive skin and exacerbate dryness and itching. In some individuals with eczema, symptoms may improve during the summer. However, heat and sweat can also act as triggers for eczema flares in others. Psoriasis, on the other hand, can sometimes improve during the summer months due to increased exposure to natural sunlight, which has anti-inflammatory effects. However, for some individuals, psoriasis symptoms can worsen in the winter, possibly due to the colder, drier air. Observing if your skin condition tends to get predictably better or worse during specific seasons might offer a subtle hint. Number 10. Response to natural remedies. While individual experiences can vary greatly, The way eczema and psoriasis respond to certain natural remedies can sometimes differ. For eczema, gentle and frequent use of emollients moisturizers to hydrate the dry skin barrier is often a cornerstone of natural management. Avoiding known irritants and allergens and taking lukewarm baths can also be beneficial. For psoriasis, while moisturization is also important, remedies that target inflammation and skin cell turnover might be more relevant. These can include moderate exposure to natural sunlight with caution to avoid sunburn, topical applications of natural substances like aloe vera or turmeric, and dietary changes focusing on anti-inflammatory foods rich in omega-3 fatty acids. It's crucial to understand that natural remedies primarily aim to manage symptoms and provide relief rather than being cures for either skin condition. Observing how your skin responds to different natural approaches might offer some clues, but it's not a definitive diagnostic tool, and professional medical evaluation remains essential for accurate identification and comprehensive management. Bottom line, understanding these 10 key differences can provide valuable insights into whether you might be dealing with eczema or psoriasis. However, it is absolutely crucial to consult a qualified dermatologist for an accurate diagnosis and a personalized management plan tailored to your specific skin condition and its severity. Natural remedies can be a helpful and supportive part of managing symptoms for both eczema and psoriasis, but professional medical advice is essential for proper diagnosis, treatment, and long-term care of your skin health.